Hi and good afternoon. My name is Dr. Valerie Simpson. I am a chaplain with Guardian Angel Hospice. I just wanted to come on to let you know that Guardian Angel, in addition to the services we provide, will be adding support to families and to the patients as well as to just members of the community by way of this website. There will be a live video every Tuesday at 3 p.m. If you wish to ask questions or if you had concerns or just wanted to participate, certainly join us every Tuesday at 3 p.m. Eastern Standard Time. Just real quickly to dispel a few of the misunderstandings that people may have about hospice. Number one, most people or many people believe that you go on hospice when you've given up hope and you feel that there's nothing left that can be done. And so you put the person or your loved one on hospice and they last just for a very short period of time. And the actual truth about hospice is that it is for people that may have received a diagnosis of 6 months or less to live. And what hospice does is come in, provide your care with a doctor, a social worker that will also tell you some of the things that you may need or benefit from and the services and resources. You'll also have access to a home health aide, which will assist the family and the patient with their hygiene care. And also, they'll watch for any types of changes in the patient's condition, the skin breakdown, anything to that effect, so that it can be reported back to the team and taken care of. You'll have a nurse that will come out and support you a couple of times a week is the standard. The aid is a couple of times a week. You'll also have access to a chaplain. Chaplain, such as myself, is one that cares for the spiritual part, and a lot of people may categorize spiritual as church, religion, but actually, spiritual part of you is the part of you that is non-material, which is the part of you that is not your body. So it would be your emotions, your conscience, your psyche, um, your decision making, those kinds of things always affect whatever is going on with the body. So whether you want to talk or whether you want to listen or however we can support you, we're going to be there in that capacity. Now, one other thing I'd like to say before I do complete this video is that, or this live, is that a lot of people think that when you've called in hospice that um, actually, they're going to hasten death and that they're going to begin to give you medications that will rush the death along. But this will actually be a benefit to the family as well as to the patient, mostly to the patient. And that is the key, is to be sure that the patient is cared for. It will eliminate the doctor's visits and the hospital stays as the doctors and the nurses and the team and the healthcare workers and the social workers as they all come out to see about you. You can select the ones that you wish not to move forward with, or you may want to use all the services that are available to you. Because there is such close care given on such a regular basis, many of the signs and symptoms of the patient's suffering from whatever the disease may be or whatever the malady may be, many of them will be brought into control or managed so that the patient is now comfortable and that the family is able to enjoy socialization with the family because they're being kept as comfortable as possible without all of the wear and tear of the running back and forth and looking for help in emergencies and crises. So, in these cases, there are patients that are discharged and no longer need to be hospice patients. So, many, many benefits. And now, as you can see, the banner is going to say everything. Guardian Angel has been around now for 30 years. A lot of hospice organizations out there. Guardian Angel has been serving this community for 30 years now, and we're around the country. So just call the toll-free number if you have further questions, and certainly watch for the lives, which will provide you with coping strategies, bereavement support, information, and how to prepare for these days, how to care for loved ones that may have dementia, and to keep in touch and communication, and not to feel that you cannot communicate with your loved one, and to be certain that they are satisfied with the level of autonomy that they have in their care. All right, with that, I'm going to conclude this live. And again, I am Dr. Valerie Simpson. I am one of the chaplains with Guardian Angel Hospice here in the Metro Detroit area. And we hope that you'll be joining us on Tuesdays, as we'll be coming to you with those sessions. All right, thank you so much.